Do you sometimes feel like no one is paying attention to you, so you do something dramatic just to be noticed? Like suddenly crying loudly when your friend is sharing sad news, even if you're not that upset. That might be more than just seeking attention. It could relate to a condition called Histrionic Personality Disorder, or HPD. People with HPD often feel most alive when they're the center of attention. They may act very emotional or overly dramatic in everyday situations, not because they're faking, but because being seen and admired gives them a sense of worth. Imagine always needing applause, even for small things, to feel okay. That's close to what someone with HPD might experience. It's part of Cluster B personality disorders, which involve intense emotions and unpredictable behaviors. Does that sound like someone you know, or maybe even you? So why does someone develop histrionic personality disorder? Well, it's like a puzzle with many pieces. Some come from childhood. For example, imagine a child who only got love and praise when they performed like singing, dancing, or acting cute. Over time, they learn if I'm entertaining people like me. That pattern can stick into adulthood. Also, if a child grew up with overly dramatic parents, or with caregivers who were either too indulgent or too neglectful, they might develop HPD as a way to cope. There's also a possible biological side. Some studies suggest that if a close family member has HPD or another emotional disorder, you might be more likely to develop it, meaning genes could play a role. Think of it like inheriting your mom's eye color, but sometimes you might inherit a tendency towards certain emotional patterns too. How do you know if someone might have histrionic personality disorder? Let's play a quick what would they do game. Scenario: a group of friends is talking quietly. Person A suddenly jumps in wearing bright clothes, starts telling a loud story with big hand movements, and seems hurt when others keep talking. That could be a sign. Other signs: feeling uncomfortable when not being the focus, dressing very provocatively to gain attention, rapidly changing emotions, like going from laughing to crying quickly, or using their appearance to impress others. They may also seem to lack deep feelings, like saying, "I love you" to someone they just met. It's not that they're pretending on purpose; their emotions just feel strong at the moment. But later those feelings fade fast. Does that remind you of anyone, or have you ever felt empty after getting the attention you wanted? There's no blood test or brain scan for histrionic personality disorder. Instead, diagnosis happens through honest conversations with a mental health professional. They'll ask things like, do you often feel ignored in groups? Or, do you worry people only like you when you're exciting? To be diagnosed, someone usually shows at least 5 key symptoms over time and in different situations. Treatment therapy is the main tool, especially talk therapy. Imagine sitting with a calm therapist who helps you say, "I don't need to perform to be valued." Over time, you can learn to build real connections and feel confident without needing drama. Medication doesn't treat HPD directly, but if someone also feels anxious or depressed, doctors might use meds for those. The goal isn't to stop being fun or expressive, just to help someone feel secure even when the spotlight is off. Can we prevent histrionic personality disorder? Not fully, but early care helps a lot. Think of it like teaching emotional fitness. Parents and teachers can help kids by praising who they are, not just how they perform. For example, instead of saying you're amazing when you sing, they could say, "I love how kind you are to your friends." This helps kids build self-worth beyond attention. Also, teaching emotional awareness, like naming feelings, "You seem frustrated," helps children understand emotions without drama. If a teen starts always needing attention or reacting extremely, talking to a counselor early can guide them toward healthier ways to connect. Just like wearing a seatbelt doesn't stop all accidents, but helps, caring early doesn't prevent all issues, but it builds strong safety nets. Recent research is starting to look deeper into HPD, which has long been overlooked. One 2022 study used brain scans and found that people with HPD may show higher activity in areas linked to emotion and reward when seeing emotional faces, meaning they might be wired to respond more strongly to drama. Another study explored online behavior, finding that people with HPD traits often post many selfies or emotional stories on social media, seeking quick likes and comments. This shows how modern tools can help us understand old disorders in new ways. Also, new therapy apps are being tested to help users practice calm self-expression daily. While there's no breakthrough cure, every study helps reduce stigma and improve support. So instead of calling someone dramatic, we might one day say, they're coping in a way that makes sense.